I'm Chad Duplantis, and I'm here with my really good friend, Dr. Jennifer Bell. And we have a wonderful guest in store for you tonight. JB, how are you doing?
Good. How are you? We're
I
1
am
week away
doing,
from midwinter. Are you ready?
it's going to be a wild ride. I am really ready for midwinter.
The schedule is really crazy. I'm not sure how we're going to clone ourselves to be in 17 different places at one time, which I'm not complaining. That means that people want to hang out with us. They want to chat. They want to catch up. We have to receive our cuspy trophy. So it will be a really fun weekend, I think. Lots of camaraderie with our colleagues, a little bit of education, a little bit of teaching, just a lot of fun being around like-minded people.
I totally agree. And, you said that they're going to have to clone us. I was looking at the schedule and I was like, there's no
No
way that
way.
we're going to be able to manage this. But we are going to be forever indebted to Uber and
Yeah.
whatever rideshare opportunities there are in Chicago. But we're going to do it upright. We're going to really do it upright.
Hey, Kelly, we're so excited to see you in midwinter. Actually, I get to see you and Kelly 2 weekends in a row. I am pinching myself. It's going to be a good run.
It's going to be a really good time. And if anybody is at Midwinter, please be sure to drop us a message at Dentist in the Know or give us a call. We'll certainly try and meet up, with all the spare time that we have. But
Well,
we
and
will
we'll have
be.
some designated locations. So I'll really try to post the schedule. So if you really want to try to hunt us down, Chad is lecturing on Thursday. We'll be visiting a couple of different vendor booths that we like and happen to use technology and materials from. So we'll have designated times that will be in different locations. So feel free to come by, but also drop us a note, DM us on Instagram or Facebook. I'll be keeping track of those if you want to try to catch up with us along the ride. It'll be fun. You definitely will get to see the real deal for sure.
Yeah. And, I think there's a name for the type of show that we might be having.
Yeah. I think it
With as
starts with an
busy as
S.
we'll be, but
Yeah.
it's going to be a lot of fun. I think one thing's for sure on what is it, Friday afternoon that we will be in visiting with our good friends at iLine and iTero for
You got
3
it.
hours.
You got it. Yeah.
And what else I will be lecturing all day on Thursday, which has been kind of a nightmare to rearrange the schedule, but hey, it's the way it goes sometimes.
I know.
Um,
I'll be with
else?
Form Labs on Friday morning on the vendor floor as well. So we'll be spending some time looking at 3D printing and a lot of the new materials out on the market, particularly if you have any interest in what 3D printing with permanent restorations looks like. We'll definitely be showcasing some of that. So come by. I think that's around 10.
Super
Central
exciting.
time.
Super
I know.
exciting. So I'm going to just briefly mention our guest. Dr. Paul Homoly is graciously waiting for Jennifer's news segment, and then we're going to bring him on. I do have to apologize because he can see us and hear us, but we can't hear him right now. I kicked him out of the room a little bit earlier. So that's one thing that you just don't do to someone of Dr. Homoly's stature. So
No.
I apologize for that. But we will bring him on in just a few minutes. But I am going to leave you alone. I'm going to leave you to do the news.
Okay.
And hey, keep it short because we have a great guest waiting in the wings.
I've been waiting a whole year for him to come back and finish the really good conversation that we didn't want it to end. Remember, the clock struck midnight. We turned into pumpkins and did not want it to be over. So
I think we were having technical difficulties.
That sounds about right. It's just
All right.
constant.
Well, hey, JB, how about you take away the news?
Got it.
Jeff is not with us tonight. He's on a fantastic vacation with some friends. So, Jeff, we miss you. But, JB, why don't you take it away and do some news for us?
You got it. So I wanted to update everyone from last week's news, which actually got a lot of traction and a lot of activity on a lot of the social media platforms, about the legislation or proposed legislation coming out of Oklahoma, specific language for dentists relating to requirements to be able to place implants in their patient population. We are happy to at least let you know that the Oklahoma Dental Association had boots on the ground and were eager to get themselves involved in the conversation, which is exactly what you want organized dentistry to do, to make sure that all interested parties are at the table and that we're both protecting the public and the dentist community as we move forward, always try to do better things for both our patients and to build healthy practices. And so they were able to successfully move that legislation off of that particular bill. It does sound like it may be reconsidered sometime this summer. So I don't think it's gone totally, but definitely has been tabled. Interestingly, there was a lot of investigation to find out the conspiracy theories began. Is this a board full of specialists wanting to shut down the activities of general dentists? But in actuality, as best we can tell, it sounds like the Oklahoma the Oklahoma board is mostly made of general dentists. So it sounds like there may be some things they really need to research and have some genuine concerns about patient health and safety in their state. And so they're trying to make good decisions for their patients. So we'll definitely be watching that. And I think this is not unique to Oklahoma. We've seen other legislation coming out of other states, specifically identifying endo, implants, oral surgery, Botox, sedation, et cetera, with very specific requirements and organizations that you need to participate in. Sleep apnea has also been mentioned in some states. So it's an interesting carve out niche that we're starting to a la carte our dental specialties and how general dentists can practice within those paradigms. So certainly something we need to be watching carefully. Smile Direct Club, we like to talk about them here on the news channel. They are launching a new product, and I'm really just alerting dentists in general to let them know in case patients are asking about it. The product is called Care Plus. It will be a tier within the Smile Direct Club platform and will offer a higher touch technology driven orthodontic platform. So I think maybe solving some of the issues that they've had with the complete direct to consumer and direct management by consumer issues that they've had with their aligner therapies in the past. This is only being launched in a few select locations: Denver, San Diego, Sacramento, and Orlando. And so, we'll just sort of keep an eye out. If you live in those areas, you may start to see patients talking about Care Plus. That is a tiered product through Smile Direct Club. Oregon, the state, is proposing, a lawmaker in Oregon is proposing new legislation to spend $20 billion to recruit and retain needed dental assistants and hygienists in their state. And this is a news story coming out of Oregon Capitol Chronicle. And they're identifying their staffing needs have become so dire in order to keep their dental offices operational and to meet the access to care challenges that they have in various communities, that they need to create a very robust program to recruit and retain qualified individuals with licenses to practice in the state of Oregon. So we'll continue to watch that. I think it will be interesting to see if this is a trend that we see in other states that typically have underserved issues and also have recruitment challenges, or just less populated states in general. But there is some support for this bill, so we'll watch that moving forward. Did you guys hear about this nursing school out of Florida, South Florida, I believe, that had graduated hundreds, tens of thousands of nurses illegally? They had paid a fee, $15,000 to obtain a nursing license, and then were able to sort of go throughout the U.S. providing nursing care. Well, they finally got busted, and now there's a big rollback to try to identify those individuals who received their nursing license from this particular institute. Whether they knew it or not, it was not a legitimate license. They did not earn the education required to become a nurse and have been operating under false pretense. So this could be a very interesting and very messy lawsuit coming forward for this particular nursing school. Makes you wonder, any dental assisting or hygiene schools out there operating under similar challenges, perhaps? I don't know. Another funny story that came out this week that's obviously up for debate is there was an article that came out in one of the orthodontist journals about the fact that orthodontists with beards and tattoos are seen less professional and may not get the best reputation amongst their patients. I don't know. Do other folks feel that way? Is that a general trend? It seems like younger patients would be very tolerant of that. And in fact, maybe find it very cool, while the parents who are writing the checks might be a bit turned off. Just a PSA for all of our dental colleagues, whether you're servicing orthodontic patients or whatever specialty or general practice you're running, your image may be creating a bit of a selection for the patients that you attract. That can be actually really great, but maybe, might be deterring some from taking you seriously. And I guess we'll say that's it for the news for this week.
So you're telling me that I shouldn't go get tattoos?
I
That I
don't
should
know.
verify that my dental degree is legit,
Valid.
and that I should be thankful if I live in the state of Oklahoma that people are defending dentists.
Yes, yes, and yes. Yes.
Okay.
Yeah.
It's very interesting. Just a real short aside here. My brother-in-law is a medical malpractice attorney in the great state of Oklahoma, which is really painful to say.
Yeah.
But he, in Texas, we have tort reform. So lawsuits are very interesting in the state of Texas. But he had a really, really interesting dental case not too long ago with some permanent paresthesia from a root canal. And so he was asking my advice on it. And of course, I just gave him some pointers and some things to ask for his expert witness. But, you just kind of wonder who was all behind that, from the get-go, and some of these cases that are out there, it makes me wonder if that kind of sets precedent for these proposed bills to be passed.
Yeah, I don't know. I think, Jeff brought up the excellent point, and it's always been my intention when working with policy and other organizations that you don't identify the organizations or reference them or even lock yourself up into them for regulation and policy, because it makes your policies very temporal, meaning if that organization goes under or no longer really represents ideal care, now you have to go revet and rewrite your laws to reflect those changes. So I think more nebulous in the organizational piece of it. And frankly, I'm a member of lots of different organizations, and I can't say that just because I'm a member, that makes me a better clinician. It's how I use that membership that ultimately I think makes me a better clinician. But just paying a dues and checking that box in order to be compliant doesn't seem to be getting the same benefit that they're looking for.
Anyways, without further ado, that's enough of us. Let me introduce our guest. If you've been in dentistry long enough, and by when I say long enough, I'd say a year or two probably. If you haven't heard of this guy, then you're not reading anything. But this is Dr. Paul Homoly. He has been involved in dentistry for a very long time. And I think that he's been providing continuing dental education for the past 23 years. If I'm correct, he lives in Arizona now, but he is just such a fantastic educator, and it's a real treat for us to have him on. Dr. Homoly, thank you for being here.
Oh, are we on yet?
Yes.
You're on. Yeah, I am so sorry for kicking you out earlier. It was all Jennifer's fault.
Well, you know what? It's always fun when you have to deal with technology like this. You never know where you're going to get kicked out.
Yeah, exactly.
I loaded the slides while Jennifer was giving the news.
Are you ready for them now?
Yes, I am.
All right. And let me ask you this. Do you have control of them on your screen?
Looks like I do. Let me do a test here. Yes.
Perfect. All right.
Is the slide showing full monitor right now?
It's showing pretty dang big. Yeah. So we're off to the side, and it's showing about 7/8 of the screen. So if you have this presentation, take it away. We'd love for you to share.
So am I visible?
Yes,
you are.
Okay. I just needed to know.
Yes, you're visible.
I think that's always a good question.
I don't want to do anything inappropriate. Here, one of the questions that always comes up when I work with clients, and clients can mean individual solo dentists, or they might be a chief dental officer of a dental support organization with hundreds of dentists. One of the questions that always comes up is, when you have a new adult patient, a non-emergency patient, do you use a dentist-first approach or a hygiene-first approach? Some practices have the new patients come in, they're checked in at the front desk, and they're seen by the dentist. They go through a new patient interview, then diagnostics, and then on their way. Other practices have a hygiene-first approach, where the patient checks in with the hygienist, the hygienist does her thing. So what I like to talk about tonight is kind of a continuation. Jennifer, last time we talked about the new patient process. We talked about how to manage that complex care patient, how to give them the sense that they'll be well cared for. We went into some depth on that, and the question and answer session was quite robust, if I remember that. Okay, so let's talk about the hygiene first versus the dentist first approach. And what I like to do is I like to start out with a poll. Go ahead, everybody.
I'm going to do it.
Go ahead and do this QR code and connect with me. Okay. And as you connect, you're going to have to put in your name and that sort of thing. I'll do it with you here. Let's see here. There we go. I'll do it with you. There we go. All right. So, assuming that we're connected here, maybe we're not connected here. Let me do something here real quick. Okay. It doesn't seem to be connecting. All right. Well, that's showbiz. I'm not surprised.
Never fails.
It never fails. Okay.
You can poll us.
Yeah. So
okay. All right. So
I'm
Chad,
showing a different first question, but yes.
Okay. Do you use a dentist first or a hygiene first new patient appointment? When your new patients come in, who do they see first after they go through the front desk?
JB, you want to go, or are you asking me?
Yeah,
Chad, I'm asking you.
Okay, so it really depends upon the initial interview at the front desk. If they're a regular patient that's used to seeing the hygienist first, that was just in for a cleaning somewhere else within the past few months, they're probably going to come in through hygiene first. If
okay. How about you, Jennifer? How about you?
Probably 85% of our new patients come through hygiene.
Okay. All right.
Yeah, I'd say about that too.
Yeah, and that's typically what I hear when I interview dentists or group leaders about their practices is, how are the patients brought in? And what I like to do is create a distinction here between the dentist first and the hygiene first approach, and maybe come to a conclusion as to which process is better. Okay, so let's talk about the dentist first approach. And Chad, I'm going to ask you, and Jennifer, are you seeing this slide that says dentist first in the upper right-hand corner?
Yep.
Okay. The dentist first approach, if we look at that, look at the top line. Now, in order to understand this a little bit, you need to be familiar with my work on the new patient process. Typically, my work centers on the complete care patient, the adult non-emergency patient that needs significant amount of dentistry. The dentist first approach really starts on the initial phone call. That during that phone call, the patient is triaged as to whether they're an adult, a child at emergency, or they want an exam. So as the patient comes into the practice, the team is prepared to offer that patient the new patient experience that most fits their demographic. There's a video that is created, and this is a generic video after the patient is appointed, typically first thing in the morning or first thing in the afternoon. The patient is sent a video, and this video is created by the dental office, and the video is actually pretty simple. It's hi, I'm Dr. Homoly. Welcome to the practice. During your new patient experience with me, and it goes on from there. And it's less than 2 minutes, and it's just a way to build likability and rapport. Next, the patient sees the dentist first. Typically, that's in a consultation area or a private office, or maybe even in the operatory. And there, the dentist really determines what's the patient's chief concern. How does that concern interfere with their life? We call that disability. How does that, what is the behavioral benefit? What is the lifestyle benefit this patient is looking for? And number 4, how does dentistry need to fit into the patient's life? Okay. And this is called the 4 chiefs dialogue: the chief condition, chief disability, chief behavioral benefit, and chief fit issue. Once the dentist understands why the patient is there and why dentistry is important for this patient now the dentist can prescribe diagnostics based on the behavioral benefit. So instead of telling the patients, oh, we take x-rays on all our patients, now I can link the value of the diagnostics to the behavioral benefit. So for example, Jennifer, you come in, you're a patient, you've got discolored composites in your front teeth. I find out that that's your chief concern. The disability is that you're a public school teacher and you're in front of students and you're getting more concerned about your parents, and really interferes with your confidence. You have dental insurance. Your husband is employed at the local internet technology business. So you get to know the patient. You form a kind of a personal relationship with patients. Understand that dentistry for patients is personal. They want it to be personal for us too. Now that I understand, Jennifer, your behavioral benefit, now the diagnostics can be prescriptive. So now I introduce Jennifer to my chairside dental assistant, Suzette, and I say to Suzette during the handoff, hey, Jennifer is here. She's got some concerns about the appearance of front teeth. She wants to be more confident in front of her students. Take x-rays that will show us, and then I describe to the patient and to Suzette simultaneously the value of the diagnostics related to the behavioral benefit. What I'm doing is I'm linking the behavioral benefit to the diagnostics. That's a key deal going forward. Plus, in the dentist-first approach, I've made a good personal connection with the patient. I am the first one to see the patient, so we're off to a running start. The next level down is we do the complete examination. After the examination, we do what's called the discovery guide dialogues. And that's really simple. Number 1, we do what's called positive framing. That is, we tell the patients all the good things we see in their mouth. 2, we make the patient aware of all those conditions in their mouth, the consequences of those conditions if left untreated. And number 3, we determine whether patients are concerned about those conditions. The next step is case conversation. A case conversation, typically in dentistry, we call it case presentation. It really shouldn't be a presentation, which is a one-way deal. A conversation is more two-way. And when you change the nomenclature around the activity, it changes the energy and the intention behind it also. So case conversation for straightforward cases can occur at that initial appointment. For more complex cases, you may need to check with the lab or a specialist or the physician. And in that case, the patient is either brought back or you do a video consult with that patient. When I actually present to dentistry during the case conversation, the next step would be the financial conversation. I would hand off to a patient advocate. That's the nomenclature that I use. Instead of calling this person a treatment coordinator. You see, that's a job description. By relabeling it, the patient advocate, that gives a sense of value to the patient. Patient advocate makes financial arrangements, insurance, and sets appointments. Then finally, after all that, then I give the informed consent conversation. Okay, so that's kind of in a nutshell, a dentist-first approach. Now, The big benefits of the dentist-first approach, it really starts the patient off on the right foot. It creates a very positive experience. And as the patient goes through the different procedures of the new patient experience, that positivity of the experience enhances, it actually accelerates. Patients form that personal connection early with the dentist. I can't overstate this. I practiced implant reconstruction dentistry for 20 years, and I'm telling you, one of the best things that I did was form early personal connections with patients before x-rays, before anything else. Okay. Next, when a dentist discovers the behavioral benefit, now that behavioral benefit can be linked to all the procedures that follow it. That is, what is the benefit of the diagnostics relative to Jennifer looking better and more confident in front of her students? What's the benefit of the periodontal treatment for Jennifer to feel more confident in her appearance? What's the benefit of replacing missing teeth? Well, it's going to be to sustain the appearance of the front teeth and not let the front teeth get worn out. So the behavioral benefit gets linked all the way through the new patient procedure. That's why it's so critical to learn the behavioral benefit, the lifestyle benefits patients are seeking before you really get too deep into care. And finally, the benefit of the dentist-first approach is that it eliminates hygiene procedures from the initial appointment. The reason I'm citing that as a benefit is that when the adult non-emergency patient comes in, and let's take a patient who's 55, 65, 70 years old. These are the patients that need significant dentistry. When they go through hygiene and then a hygiene procedure, then a full examination, then a consultation, this wears the older patients out. They tire. Plus, when I talk to dental hygienists who perform pro-fees as part of the examination appointment, many hygienists tell me the patients aren't giving them their best shot. They're not giving the patients their best shot. Oftentimes, hygienists are rushed during that pro-fee. All right, what are the drawbacks? Well, it lacks efficiency. That is, if you're looking for a purely efficient practice, well, the dentist approach is not going to give you that. Okay, it's not about efficiency here; it's about effectiveness. Next, dentists who lack confidence in their communication skills can struggle with this because they're not good at forming personal relationships. They're not good at chit chat with patients. Next, the dentist-first approach really requires the dentist and the team to kind of rethink about how they influence patients into care. You know, the traditional thinking around treatment acceptance is education, educate. But I've polled dentists for 30 years on the leading reason. I mean, think about it. What's the leading reason why patients who need significant dentistry don't get it done? Is it because they don't want it, Jennifer? Is it because they don't believe the dentist? Or is it because it simply doesn't fit into their life right now? You see, it's about how the dentistry fits into the patient's life circumstances. And there's no amount of patient education that's going to change that. So the influencing aspect of this is really based on the relationship, not on the education. And the dentist-first approach really is about influencing patients through the process of understand that patient education and understanding patients are on opposite ends of the spectrum. In patient education, we want patients to understand us. What understanding patients is that we want to understand the patient. So there's a flip there. And sometimes dentists and teams have a little bit of a hard time with changing that paradigm in their head. Next, a drawback is the hygiene collections are absent from the new patient procedure. I presented this webinar a few months ago, and during the Q&A, one of the questions was, well, our hygiene schedule is all screwed up, and we need those pro fees during the new patient examination. And I would say to you, don't try to fix a hygiene department that's broken with your pro fees from the examination. That's not the way to go about it. Okay. All right. So here we go. We don't have our polling function, but let me start with you, Jennifer. What percentage of your new adult patients name periodontal issues as their chief concern? That is, new adult patients, non-emergency patients come in, Jennifer. What percentage of them tell you that they're most concerned about their periodontal issues? And now you've got a choice there. What would you say, Jennifer?
So
okay, you're next.
Yeah. So it's interesting. I have two different practices with two different like demographics. In one practice, I would say 5% or less, and the other 10%.
Okay. So 10% or less. How about you, Chad?
I would have said 5% or less.
Okay. And this is true no matter what group I talk to. Of course, not periodontal practices. Okay.
Yeah, right.
But general dental practices tell me typically 5 to 10% or less of their new patients when they come in cite periodontal concerns. And yet 85-90% of these practices have a hygiene-first approach to the patient. So periodontal issues are not on the patient's mind. And yet, what is the first thing that they're exposed to during the new patient experience? Periodontal issues. See, there's a disconnect there between the chief behavioral benefit the patient is looking for and the structure and process of our new patient experience. Do you see that?
Mm-hmm.
Okay, so now let's look at a hygiene-first approach. And this is very typical. A new patient comes in, we're on the top line, new patient comes in. First thing that happens is, they're welcome to the practice. And then they go see the hygienist or a chairside assistant, and x-rays, scans, photos are taken. And then they go into the hygiene room where there's an examination done. Hygienist does maybe a pro fee, and then there's a handoff to the dentist. Okay. Now, then following that, the dentist does an exam, post-exam discussion, then a clinical case presentation. Typically, the dentist does not present fees. Typically, the dentist, and some dentists just put together a treatment plan and hand it to the treatment coordinator. Then the treatment coordinator explains the treatment and then the financial conversation around that. And I want to be real clear here. I'm not saying that this is wrong. I'm saying that for the adult patient, for the senior adult patient who has significant dental needs, this experience right here doesn't give them the level of standard of caring. Standard of caring is all about signaling patients they'll be well cared for. And for younger patients who simply want to get in and get out of the dental office, this is fine. This works really well. However, for that 65, 75-year-old person who's got a mouth full of problems and they're on their third set of dentistry in their mouth, they want something a bit more. So let's look at the benefits of a hygiene-first. It's very efficient. The dentist can be running from chair to chair doing his or her thing. Very efficient. This is a really good fit for modest care patients. For those younger patients who don't have a lot of dentistry in their mouth, or typically they come in for an exam and a cleaning. It's like peanut butter and jelly. Exam and a cleaning, right? Delegating the complete periodontal exam to hygienists can help ensure a higher standard of care. Again, my conversations with hygienists, they're adamant about oftentimes dentists will maybe shortcut the periodontal exam because they're more oriented towards cosmetic dentistry or restorative dentistry or implants. And, periodontal disease isn't, really high on the list in terms of what gives them the satisfaction of practicing dentistry. So by delegating that to the hygienist, then we get a true periodontal examination. And one thing that I really like about the hygiene-first approach, it really helps position the hygienist as a mid-level provider. It gives the hygienist more status. And again, conversations that I have with hygienists, and I believe me, I speak with hygienists that are in big practices and small practices and specialty practices, and many of them cite the sense that that maybe sometimes they feel like the cleaning lady. Maybe they just don't have the sense of fulfillment that they thought they would have as being a dental hygienist. So the hygiene-first model, I think, helps build the credibility of them as being mid-level providers. The drawback, the big drawback again, is for those adult patients who need complex care. And they're really looking for, again, they're looking for a relationship. Again, it's personal. They want it to be personal for us too. And there's no substitute for having a good, private, quiet conversation with an adult patient and understanding, why now? What's important to you for your dental care now? When you have a patient who has complex care, and it's been that way for a while. They've got missing teeth. They have orthodontic issues. They have aesthetic issues, maybe phonetic issues. And it's been like that for a while. They may even tell you, boy, it's been years since I've been into the dental office. When you see chronic conditions and you hear patients say, boy, it's been years since I've been in the dental practice, one of the best questions you can ask this type of patient is, why now? So if Jennifer tells me, oh, it's been, 5 years since I've been to the dentist and these teeth are giving me a problem. I don't feel confident in front of my students. I will slip in that conversation somewhere in the middle. I'll say, well, Jennifer, you mentioned it's been a while since you've been into the dental office. Why now? What's going on now that makes dentistry important for you? And then you shut up and you listen. And patients will tell you, and you're going to hear one of two things. You're going to hear about an upcoming life event. Oh, I'm getting married, or I'm interviewing for a job, or we're going on vacation, or we're getting family photos done with the grandchildren. You're going to hear things like that. So an upcoming life event, or number two, you're going to hear about a change in life circumstance. Patients say, well, I've wanted this for years, and now the kids have graduated college and they're out of the house, and now's a good time for me. So an upcoming life event or a change in their personal, financial, and life circumstances enables them to get the dentistry. That's a big drawback of the hygiene-first approach, unless, of course, the hygienist is willing and trained to do it. And we're going to get to that in a minute here. Another drawback of hygiene-first approach, it really doesn't distinguish the practice from other general practices. Again, 85%, 90% of the dentists out there are using a hygiene-first approach. So if a patient's going from office to office to office and comes to your office and you get the same type of approach, then it really doesn't distinguish you as something special. And number three, and we covered this earlier, I have surveyed literally thousands of dentists for over 2 decades and asked them the same question I asked Chad and you, Jennifer, at the beginning of this webinar. What percentage of your patients cite periodontal issues as their chief concern? And typically I see 10% or less, 5% or less. And yet, what are we hitting them with first? We're hitting them with something that we believe should be the most important to them. But that isn't what creates treatment acceptance. That isn't what creates a positive experience for the patient. I'm not saying we don't offer periodontal care. I'm saying you simply don't talk about it first because it's not interesting to the patient. It really boils down to that. They're not good listeners. Okay, so is there a blended approach? Is there a blended approach that we could use that would maybe capture the best of both worlds? Well, yes, there are, and I talk to hygienists that do this. Let me show you a blended approach that really captures the best of both worlds. The efficiency of a hygiene first approach, but the relationship building of the dentist first approach. What we're going to do is that patient comes in, we do the video, they're shown the video, then the four chiefs conversation, that is discovering their condition, the disability, the behavioral benefit, and their life circumstances. That conversation is facilitated by the hygienist or the patient advocate. That is, that the dental hygienist is probably in the best position. I'm talking about a mature dental hygienist that's been cleaning teeth for years, and she's looking for ways to give herself more credibility, more fulfillment, and to give herself a raise. And it's been my experience working with hygienists is that when you're working with the right hygienist and they're taught how to create the environment with a patient during a new patient interview where you give them the experience of being understood. Hygienist can do it. Now, the hygienist captures the behavioral benefit, the lifestyle benefit. Now, she can voice the prescriptive diagnostics. That is, how do these diagnostics advance the lifestyle patient? The lifestyle benefits this patient is looking for. The hygienist does a complete exam and does a hygiene handoff to the dentist. No periodontal procedures, no prophy, no prophy. We take the prophy out because the hygienist simply is not going to have enough time to do a good job. Next, she hands off to the dentist, and now it's a dentist approach all the way with no change. The dentist does the exam, does the post-exam discussion, determines the concerned and unconcerned conditions, presents the case, financial conversations, patient advocate, and just goes right on down the line. So the dentist and chairside assistant and patient advocate picks up the ball from when the dentist, or rather when the hygienist really starts the process. Okay, that's called a blended approach. In order to make this happen, it's best used for the new adult non-emergency patient. Number two, those patients are seen first thing in the morning and first thing in the afternoon. Here's why. It makes it for so much easier to schedule this. Understand the hygienist, when she's not seeing new patients, is going to be doing her hygiene procedures. So she can set up her rest of her day. So if she's seeing a new adult patient first thing in the morning, then she can plan the rest of her day around that, where she's not juggling things. Unbundling the hygiene procedures from the new patient experience would be important. Now, you need to forecast that. You need to foreshadow that on the phone or in your web materials or in your marketing materials to let patients know that they will not be getting their teeth cleaned at the first appointment. Again, this is for the adult patient with significant problems. This is not for the young patient that's looking for peanut butter and jelly. Exam and cleaning, okay? The hygienist, they need to be engaged. This is for the hygienist that really wants to step up. And I would say you're probably going to have some conversations with your hygienist. Well, she's not doing hygiene, and depending on her compensation formula, you may need to establish a compensation formula that compensates her for being that leader of the new patient experience for you. And in all the perio procedures, or some of those perio procedures that are normally done as part of the exam and the cleaning, those are bundled into the treatment plan. That is, the prophies or the scaling and root planing, that's all bundled into the treatment plan. So when periodontal procedures are to be actually delivered, they're delivered all at one time. It's not piecemeal. Well, I'm doing a prophy today, but you're going to need a better cleaning later on. That conversation just gets to be awkward and cumbersome. Okay. Okay, now I'm going to give you a tool right here. In order to make the dentist first approach work, or the blended approach work, you're going to need to see these new patients at a specific time during the day. I'm going to highly recommend you see them first thing in the morning or first thing in the afternoon. This way, you can you won't have any other whoops, we kind of went backwards here. You won't have any competing procedures in the other operatories. You can give the patients that experience of being understood. And if we have time here, we're nearing the end of my time right here, but the strategic schedule what you do in order to get this. This is designed for your front desk team. Go ahead and pick up your smartphone right now and text the word schedule to the address 55444. Go ahead and do that now. And while you're doing that, what this strategic scheduling dialogue summary will do, it will train the person who manages the new patient's schedule to identify whether the new patient caller is a adult non-emergency patient. It's that adult non-emergency patient that needs or wants complex care dentistry that for most general practices is the best way to improve profitability of the practice and fulfillment in one's career. Okay.
I have a question for you.
Yes.
So, one of the benefits I think, at least I've observed in the hygiene first approach, is we didn't talk much about trust and the general consumer's distrust of dentists or medicine. And, because we own it and we have a financial reward, it's an interesting system because we have a financial reward to find things to do, et cetera. And so I've heard, some folks talk about the validation of that exchange between hygiene and the dentist. Somebody identifies it, but then it's validated by someone who has less of a financial interest in the practice to sort of say, yes, this is true, this is not true. How do you see this playing into those two different models that you're proposing?
Well, Jennifer, I don't agree with you. I think, the whole idea that the public doesn't trust dentists, when you look at national polls of trustworthy professionals, dentists are high on the list. So number one, I don't buy into it that patients are looking to, that patients are overly suspicious.
Okay.
I don't buy into that. Oh, you're going to have some people who are going to be overly suspicious. There's no question about that. Number two, there's going to be lots of opportunity for second person validation of the conditions in the patient's mouth. All right. Certainly during a blended approach, the hygienist is seeing this patient first and giving the patient a sense of what's going on. In the dentist first approach, the initial conversation the dentist is having with the patient clearly showcases to the patient that this practice is different. Mm-hmm. With a dentist first approach, we're not running them in and we're not getting people in and out. We're not seeing 50 patients a day. We're not seeing that at all. So my suggestion to you would be that if you have fears about whether patients believe you, and if that's the issue here, then that goes back to not giving patients the standard of caring they're looking for, not giving patients the experience of being understood.
Mm-hmm.
So I have a question for you, and I think you answered it. But I have to say, I see where Jennifer's coming from first, because I was thinking that as well, and I do like your answer. But my question was revolving around the blended approach. I love that approach. The first question is that you had said not necessarily, it's somewhere along these lines. You said something like, not necessarily for children. You said for adults, and you said for adults with complex dental problems or
That's right.
whatnot. So are you saying that through that initial phone call, there could be a determination if this patient's going to come in and actually get a traditional, what we see as traditional hygiene-first dental appointment? Or are you saying that every new patient that's an adult should have this blended approach with no promise or no expectation of dental prophylaxis? And I believe it was the latter based upon something that you said later.
Yes. My position here is for those adult non-emergency patients, use a dentist-first approach with them or a blended approach. For the younger patients who have minimal needs, modest care patients, then a hygiene-first approach is very appropriate. See what I'm saying here, Chad? You have both in your practice. You do both. You do both. We don't treat occlusal disease the same way for every patient. We have differential diagnosis. Well, I'm saying your differential diagnosis occurs on the phone. It occurs on the phone. So people who work at the front desk, they do more than just appoint patients. They act more as dispatchers. I recently bought a widescreen TV from Best Buy, and I paid $300 for being a concierge member of their geek squad. The geeks come to your house and they fix everything for you. And I had an issue with my sound bar, so I called the concierge number and I talked to their dispatcher. And the dispatcher went into great detail. And well, terrific. Dr. Homoly, glad you called and tell us what the issue is. So I told him, can I have the model number? Do you have, 5G? Do you have 4G? He went into some specifics. So when that technician came to my house, he was prepared to make me happy. Now, look at the role of your front desk person who handles the phone. In less of a looking at her as simply somebody who makes appointment, but consider her in the sense of a reverse dispatcher. That is, she's gathering information to give to the team before that patient comes in the door. So often, Chad, we don't know whether this is a complex care patient or a simple patient until they show up. Now it's too late.
And in the hygiene-first approach, I think and I'm guilty of it too, you end up shortchanging some people.
You shortchange a lot of them, but especially for the person who has been putting it off. And one day something happens. Grandchild's getting married. Everybody's going to fly to Chicago for the wedding. Your teeth look like hell. And now it becomes important. You go, I got to get this done. So now the expectation of a good result, the expectation of, boy, I really want to get this done. Don't let them down. It's personal for these people. And so when it needs to be personal, that's when I would shift into a first appointment in the morning or first appointment in the afternoon, dentist first approach.
I really like this. So my final question is that we got basically just fed through a fire hose for 30 minutes. Where can we go to digest this information? Do you have courses coming up or something that we could learn more about this? Because I know there's a lot of people there's a lot of people out there that are stuck in a rut and they want a way out. Where could we go?
Sure. Right there. There's the slide. Use your smartphone, shoot that QR code. It's called Treatment Acceptance Mastery. This is a online program. I believe it's the most complete body of work on the new patient experience and treatment acceptance in dentistry today. I get into significant detail. Yeah, we had 30 minutes to talk about a complex topic, but it's a topic that everybody deals with. Every general dentist has to make a choice, dentist first or Hygiene-first. And typically they default to Hygiene-first because that's what the guy across the street is doing. That's what they hear in seminars. That it's a default behavior. And I'm saying, why? Why do that when you have patients who really want the dentistry? It's at a good time in their life and they're ready for it and they can afford it. And not giving them the experience of being understood, not giving them the idea that they'll be well cared for. I just got off the phone this afternoon with a dentist in Gilbert, Arizona. And he recently been through my training. He had grandma coming in, nasty teeth, a reconstruction that was falling down. They identified her as a right side patient on the phone, or rather a complex care patient on the phone. They set aside time, first appointment in the afternoon for her. She came in, instead of turfing her off for x-rays and photos and scans like they would typically do, the dentist sat down and did exactly what I just said to you. He asked her, what's going on now that makes this important? She said, at my age, what have I got left? I want to be able to smile. I want to be able to have a meal. I just want to be able to enjoy my final years. And he had this soulful conversation. She ended up putting a down payment on a $23,500 case at that appointment. That never would have happened if the time the dentist spent talking with her, if that time was spent taking x-rays and models and scans. I mean, what gives the patient a better experience of being understood and valued? Diagnostics or a soulful conversation with the dentist? It's an easy decision, Chad.
I don't disagree. Paul, this was just so fantastic. I really thank you for your time, and really the slides were so beneficial. I mean, it's wonderful that you're willing to share this knowledge with us, and just some great pearls, some great takeaways. I've already texted the number and I've already got it on my phone. The information that you shared at the end. So I want to thank you. What a great time. I'm sure we'd love to have you back if you'd be willing.
Oh, of course I'd be willing, and I would say next time I'll narrow it down. I will narrow this down. For example, what would be the key ingredients to that new patient interview for that complex care patient? Maybe we'll narrow our scope so we feel it's less of a fire hydrant.
Hey, no, I get it. I mean, I get it. I wasn't knocking you for that. I certainly appreciate it. I just was sitting here trying to digest. I'm taking notes. I'm, trying to figure all this out and listen to exactly what you're saying. And I was like, okay, this, and this. I didn't know where you were going with the blended approach. I really didn't. I thought you were going to give us one or the other and tell you which one was your favorite. I love the blended approach. I think there's a way that everybody can win. So thank you.
Yeah. And you know what? Your hygienist will thank you too. And that hygienist can't be a rookie. This needs to be somebody that's been in the trenches and she's ready for a change. And give her a chance to use her verbal skills, her personality skills, her experience with patients like the one she's talking to. And that way, Jennifer, you can, if you have in the back of your mind that you need, the patient needs to have a second opinion in the dental office, well, then there you go. You get them both. Okay.
Well, thank you so much, Paul. We will have you back. We're going to reach out and try and get you back on. Hopefully not a year from now, but thank you so much for devoting your evening to us. I really appreciate it.
Okay. Bye for now, everyone.
Bye.
Thanks,
wow. What a great.
I learned so much from him every single time. And, his suggestion for a future topic is so helpful because so many of our colleagues are struggling to train and onboard really good people at the front desk, as well as, in the back of the house, to be able to help discern and adapt and adopt these particular trees that he's sort of creating for a practice, which I think have tremendous value, and, people make it work.
Absolutely. Well, I think there's a lot to digest, but we're over. So how about we just call it a night?
I think we should make one more final announcement. So next week, we all three will be in Chicago. So I'm hoping maybe we'll pop on for a bit just to say hi. We'll be doing a couple KOL events and a few things on Wednesday. So we will not have our live show, but we actually have a fantastic program already waiting for you and ready to be launched that night. So you definitely don't want to miss it. We'll announce that next week. And remember, if you're going to be in Chicago next week, please reach out and let us know. We'd love to meet you and actually put some faces to the names of folks that comment, post, and reply to the activities in Dinks. Have a great night, everybody.
And if you're in Chicago next week and you have maybe a little testimonial about what you think of Dentists in the Know, let us know, because you never know. We might have a little videographer there to take a little tidbit of what you have to say.
Maybe a Starbucks gift card.
Yeah. So anyhow, thank you all very much for being with us. What a wonderful treat. I'm certainly leaving recharged and refreshed.
Same.
And, just whatever you're doing, just know that there's not a right way. There's not a wrong way, but there may be a better way. So just always be open to listening to new ideas. I loved what Dr. Homoly had to say, and I hope you gathered something from it as well. So y'all have a wonderful evening, and we will see you next week.
Good night.
Thank you. Good night.
And that wraps up another podcast for Dentists in the Know. On behalf of Dr. Jennifer Bell, Dr. Chad Duplantis, and myself, remember that we've got a great profession, so let's make it a great day, Dinks.